News.
New results from a UC San Diego and Salk Institute clinical trial show how time-restricted eating can improve cardiovascular health among certain people. 150 San Diego firefighters participated in this trial. Now, firefighters are shift workers who often work overnight. They sleep unconventional hours. Shift workers are also at increased risk for everything from obesity and high blood pressure to diabetes and heart disease. Joining us now is Emily Manoogian, first author of the study and staff scientist at the Salk Institute, to explain just how these results could apply to others. Welcome.
Hi, thank you for having me.
Good to see you. So I understand the firefighters could only eat within a 10-hour window. Did it matter what they ate and how often?
So everyone in the trial, including our control group, was given a recommended Mediterranean diet, but it was not a strict adherence. It's kind of the standard of care of this is what you should follow. The only difference between groups was that the time-restricted eating group ate within that 10-hour window, and they got to pick a window that worked for them. So they're not skipping meals. The typical eating time was 9 a.m. to 7 p.m., so it's nothing extreme, but it helps their body maintain their metabolic rhythms and really be a healthier version of themselves.
Can you talk about why shift workers tend to be at high risk for so many of those diseases and why this helped boost their cardiovascular health?
Yeah, shift work is really hard on the body. If we had the option to eliminate shift work, that would be wonderful. The reason is we have circadian rhythms. Our bodies work on about a 24-hour rhythm. We're meant to be active and awake and eating during the day, and we're meant to be resting and fasting and sleeping at night. And unfortunately, we don't have that for shift workers. And really, they're the heroes of our society. They're the ones that are protecting us 24 hours a day, responding to every single call you could imagine, whether it's a heart attack or a fire. They're the ones that are going to be there. And so they're being there for us, but unfortunately, it's really hard on their bodies. So the study was really aimed to try to find a new way that we could help them. So even if they can't change their sleeping patterns, maybe they could change something else to decrease this burden.
So presumably then this could help other shift workers, whether they're in healthcare, the military, TV news like us. But what about people who work more normal hours? Would this also help them?
Yes, absolutely. So most studies are done in non-shift working adults. In fact, this was built off of previous research from our lab as well as many other labs, both nationally and internationally, that have shown time-restricted eating of somewhere between 8 to 10 hours has a variety of health benefits. Now, so far, most people that have been studied are individuals with diabetes or prediabetes or are overweight. And in all of those categories, we've seen decreased weight, improved glucose regulation, overall improved quality of life. And so it's really exciting to see those changes. And that's what really kind of spurred us to start this study was we were seeing this in a non-shift work population. And even though shift workers are at an increased risk for so many different chronic diseases, they're usually excluded from studies because their schedules are so complicated. So this was really an exciting step forward we got to take and a fun challenge to find a way to be able to help this very special population.
Yeah, it's very interesting. So what about when shift workers are off or on vacation? So you said that even for people who eat in a different time schedule, this 10-hour time limit could be helpful. Should they try to stick to some sort of 10-hour limit even when they're not working?
Absolutely. So this was every single day. They were sticking to the same 10-hour window. Occasional, you have a birthday party or a special occasion, an occasional cheat day is fine, as long as it's not the norm. But this is something that it's not a special diet. It's not a one-time just for shift work. This is really a healthy aspect of living, is allowing your body to metabolize food when it's meant to do so. And this applies to everyone. So we think somewhere between an 8 to 10 or even up to 11-hour eating window is really the ideal amount of time. So your body can rest at night and repair and not get all that glucose later in the day.
Now, you mentioned that this type of eating could help with some of those other diseases as well. This specifically showed improvement with cardiovascular health. Are there any future studies planned to try to see if there's anything else that can be tweaked for shift workers so that those other things, such as cancer and diabetes, could also be curbed?
Yeah, absolutely. So within this study, we found that there were overall benefits for the whole population, which overall started at pretty healthy levels, and a very bad form of cholesterol called very low density lipoprotein, which is usually used to form plaques. And so we're excited to see that overall. But then the really exciting thing was for the individuals who participated that did have elevated blood pressure or elevated HbA1c, which is kind of a gold standard measure for blood glucose or blood sugar. We saw those significantly decrease in the time-restricted eating group by pretty dramatic amounts. So we think that both blood glucose regulation as well as blood pressure, and also likely with other types of cardiovascular health, this could be really helpful. When we get to cancer, that's something we also think that it could potentially help long term. We've seen in other studies, even in rodent models, that we can see that time-restricted eating helps decrease inflammation. Luckily, though, our participants were not at that risk. So within a 3-month period, we're not able to see a change if they're already healthy in that way. But this is something we'd like to pursue further.
Why 10 hours? Why not 9 or 11?
No, it's a great question. So there's been a few different studies now to show if you go less than 8, you don't see any additional benefits. You see about the same benefits between 8 and 10 hours, and even going up to 11 potentially. Once you hit 12 hours, you don't really see a lot of the same benefits anymore. So we think it's somewhere between an 8 to 10 hour window. If you do assign a 10-hour eating window, some people push it a little closer to 11, and we still see most of those same benefits. But the exact amount of time is still a little bit unknown. I think it's just really from the clinical trials that have been done, again, from many different labs across the country and as well as internationally, showing that you do see these, pretty drastic health benefits anywhere from an 8 to 10-hour eating window.
Oh, it's very interesting. I'm definitely going to try it. Emily Manoogian, study author and staff scientist at the Salk Institute. Thank you so much for sharing those findings.
Thank you so much for having me.